What's happening where you are?
Thank you very much to you, Nompu. We are at Jika Joe informal settlements, as you have said in your introduction there. I'm joined by the Health MEC in the province, Nomagugu Semelane Zulu, to talk to us about the campaign that is actually being launched here today in this part of the province. MEC, thank you very much for your time. The province of KwaZulu-Natal is facing quite a serious challenge in terms of the number of infections, one of the top 3, in fact. Are you confident that you will be able to actually address this by embarking upon this process?
No, thank you very much, and we really appreciate you guys coming. As you would know, our numbers as the province of KwaZulu-Natal, particularly the numbers of deaths, are a bit high compared to other provinces. And this is an issue that has made us to be very worried, because it means they're not in proportion with the people who have been infected. And as a result, we then decided that while the president had also made an announcement that we need to go to communities and actually conduct community screenings, it means our responsibility, unlike other provinces, is actually more stronger, and we should do a little bit more. Because when you look at our numbers, the indication is that people who might be positive are a bit more than what we actually have on our statistics. Now, that doesn't mean we are undercounting in any way, because the people that we have on the list are the people who have actually tested and come forward. But in essence, it means there are people who are in communities that have actually not come up to be tested and screened and so forth. So we then decided that let's make sure that we concretize this particular program of community testing, but we go a step further and say even in our actual facilities, our hospitals, we then have screening and testing centers that are outside the hospital. So even people, before they come into the hospital, no matter what they are coming to see the doctor or the nurse about, they will still now be screened, because we think we need to find more people that are out there that have not been coming to us. So we are confident that this is going to be a success. But what is most interesting and what is exciting to us is that it will also give us an opportunity to find the people that we believe are missing. As a result, out of this program, we actually really do believe that we are going to get, you will see our numbers as a province going up in terms of those infected. That is not going to be a bad thing for us as a province. The fact that the numbers will go up is not going to be a bad thing. It's good in that it then gives us an opportunity to isolate those or quarantine those that are positive and separate the positives or those that are infected from those that have not been infected. And then we'll be able to deal with this pandemic in that fashion.
MEC, another concerning issue is the issue of PPEs in the province. The Health Minister, Dr. Mkhize, in one of the media briefings said that health workers must not risk their lives and work without protective gear. How is the situation on the ground? How confident are you that each and every single nurse who actually does this work is actually protected?
This is a challenge that we have been faced with, not just in the province of KwaZulu-Natal, but the whole country. And in fact, the whole world, because this pandemic is affecting the whole world. I must say that we didn't have a challenge with PPE because the Department of Health had not planned to actually procure. We actually had procured, but it found that the PPE itself is not available in the market. That is why you ended up having the minister speaking to the Minister of Trade and Industry to try and get this PPE from outside the country. The minister even took it a step further and engaged China, and that's why I think you would have seen about a day or so back, the minister went and welcomed the PPE that was donated by China and other countries. So we are confident that our workers, that our frontline workers are having or are protected. Remember, it's not every worker or every health worker that's going to be wearing a visor or that's going to be wearing an N95 mask, but it's purely those that are going to be are working with the patients and are testing them. Now, our workers that are testing the patients, they will be kitted fully, because they need to protect themselves, because they don't know, those who are testing, they don't know who they are testing. But those nurses that are taking your BP, your sugar levels and so forth, can wear a mask like myself and put on a plastic overall, and that is sufficient. So it's only the healthcare workers that are dealing specifically with the people who are infected, but also only the healthcare workers that are doing screening and testing, because at that point we are not sure whether the person you are working with is infected or not. So we are confident that the people who are on the front line have enough. But having said that, and we do have enough in the province, by the way, having said that, the reason why it has been it's seen as if we are struggling a little bit, it's because we are stocking for the next month or two, because we don't know how long this epidemic is going to last. So we need to be prepared. We don't have to find ourselves running out of the PPE. But I must say that even those that have been ordered by the department in the province have gradually begun to arrive and they've been delivered. So at this point, we are quite sufficient. We've got sufficient stock. But I must also indicate that we also decided that the issue of PPE, because of its importance, we will elevate it to be managed by a deputy director general. That's it, a deputy director general at a level of the province. But at a level of a district, the district manager or district director is responsible of ensuring that on a daily basis they know what PPE is in which hospital. And once they see on their dashboard that there is a hospital that is running out of a PPE, while there's another hospital that has a bit more than what they are utilizing, then they shift those around. And the reason why we decided it must be the district directors is because even when in these times of this epidemic, we still have to manage the equipment that we have, we still have to manage our resources, and we must make sure that those that are utilized are accounted for.
MEC, another concerning issue is the issue of the closure of the private hospitals in the province, two of them, Kingsway as well as St. Augustine. What interventions are you going to put in place there to ensure that these hospitals reopen soon?
Well, the closure of these hospitals are our intervention. We have instructed that they must be closed because we wanted to make sure that, firstly, we are sure that all the facilities in that particular hospital have been fumigated and there is no virus that is there, and it will take a bit of a few days for it to reopen. However, we have also decided that it is clear that we need to start instituting in-depth investigation on what is actually happening. Now, because we have provided these hospitals with a license and it was done legally, you can't just legally withdraw the license from the facilities if there has been any wrongdoing. So we need to actually do a proper and a thorough investigation, which is what we have started to do, so that investigation, when it comes back and there's an indication of some wrongdoing at some level, we're then going to be able to institute a proper action. Whether that action means the facility is fined or the facility closes down, at this point we won't be able to talk about it because we need to get the reports or the results of that investigation.
MEC, thank you very much for your time.
Thank you very much.
That's the MEC for Health in KwaZulu-Natal, Nomagugu Smelane Zulu, saying that they are going to put interventions in place to ensure that the two hospitals which have already shut their doors, Kingsway Hospital as well as St. Augustine, reopen soon. Another concerning issue when it comes to the issue of statistics here in KwaZulu-Natal is that of those of the 34 people that have died in the country due to the COVID-19 pandemic, actually 18 of them are from this province. Nompu, it's back to you in Johannesburg for now.
Thanks very much, Simphiwe, for that report. My colleague there, Simphiwe Makhanya, reporting from KZN.